Hi guys, welcome back to another YouTube video. I'm Chantal.
Shawnee P.
So today we're gonna be doing a little Q&A discussion, seafood mukbang. We're basically just dropping some tips on preparing for the NCLEX examination, right? Persons are always studying for NCLEX, so we thought it would be a good idea, since both of us have been through it. We have different learning styles and everything, so I thought it would be a good idea for both of us to come and just share some tips with you guys and have some seafood. All right, so we have some crab legs, we have eggs, shrimp, corn, potatoes, sausage that I don't really eat, and we have a lobster tail. So we're gonna dive in and start the discussion.
The first point is to identify your learning style. So some persons are hands-on learners, some persons sit, listen, absorb all the material, and some persons have to read. So first thing, you have to know your learning style, so you can, the best method or way for you to absorb and retain the information that you are getting or you are reading. So for me, I think I am a auditory learner. So what I did most of the time, I go on YouTube, type in the topic or the subject area that I want to focus on, and then I will sit and listen.
Alright, for me, I'm an auditory visual learner, so I do well with listening and actually seeing or participating. So the videos work well for me. When I was studying, I did use like YouTube videos, which is very good, and also I think, what's his name, klimek. He's very good because he basically is like recorded lessons that you listen to over and over.
So yes guys, so one of my method also in listening, I found an app that you can put the information into, and whichever book, it just reads the information and you just sit and listen. So it will define whatever definition or condition you're studying or looking into. It will just read all the information, the pathophysiology, the causes, the treatment, management. So you just put the information in the app and it just reads the information to you. So that's tips number one. Tip number one, right? Identify your learning style. You have to know your learning style, lest it won't work. If you don't know which method work for you, you'll be just reading or listening and the material is not absorbing or retaining in your brain. So you have to identify your learning style. Second tip, guys, you have to practice questions. NCLEX style question, not to just go on a random site and just pick some questions and try to answer them. You have to answer NCLEX style question. Practice becomes perfect, right? So you're going to identify or get your resources, right?
Food nice.
So in practicing question, you have to get credible resources, not just any random book, right? Credible resources to practice your questions. Practicing questions. I think the least amount of question I should do for the day is like 100 question. Or if you're starting out, just starting out 50 for the day, and ensure you ensure that you know the rationales or the reason why they come to that answer. Just don't try to look at your grade or how much you're getting, like if you get a 50 or if you even get 0. Don't get stressed, don't get depressed. Focus on the rationale and make sure you retain that information, right? So next time when you come across a similar question, you can answer it properly and get it correct, because all the questions are like interrelated. So when you identify the rationales, I think it's when you know the rationale, I think the information sit with you better.
Alright, so in answering questions daily, I don't know, based on your schedule or what you have to do, you ensure that you plan your day and include time in your day for you to study for your NCLEX. Alright, it also depends on when you have your exam, because you know if you have your exam in the next month or so, you're gonna dedicate more time throughout your day to focus on answering NCLEX question, versus if you're just starting your process and you know that you may not do your exam until like a year. You know, you may just do like a 30 minutes per day of reading NCLEX or reading information. So it depends on when you have your exam. You do your schedule, you ensure that you put time in to study. So for example, you're going on a day shift, you're going to work at 7, you wake up at least 45 minutes earlier. You can do at least 20 questions in 45 minutes. Write down your rationale, and then probably at work on your break time you go back over those rationale that you have written down, just to ensure that the information sticks. And then if you're doing like a 8 hour 7 to 3, you know, you get home at 3, you pay attention to your kids or your family, you prepare a meal. Probably about 9:30 you put another 45 minutes aside and you do another 30 questions, right? So you have already mastered like 50 questions for the day. And then eventually, as the time gets closer, you try to put in more questions. As he said, try to do at least 100 questions per day. It seems hard, it may seem impossible, but it is doable, right? If you listen, let me tell you, if you want to do it, you have to do it, right? I remember when I was studying for NCLEX, when my day was coming up, I recently had baby. The baby was like 2 months, 3 months. The baby was on the breast and the book was in my hand. Like, that's how hard I had to go. So you really have to set the time aside or split your activities. If you have something important to do that you probably don't have to be talking or listening to anything. For example, you're cooking, put your phone on a YouTube NCLEX video or audio and you listen to that while you're cooking. You may not get all the information at that time, but at least a point will maintain or will remain in your brain. You will be surprised. So do that. Also too, you try to, as it relates to the resources, well, I'm going to tell you about the resources in a little bit, but try to get information from a wide range, right? So you can say, all right, then this month I'm doing UWorld, the next month I'm going to be doing Kaplan, or the next month I'm going to be doing Hearst Review. Try not to do questions from too many banks at one time, because you can do 5 UWorld today, you can do 5 Kaplan tomorrow, you can do 5 Hearst, but at the end of the day you will be confused, right? You won't really understand the information. So try to focus on one resource at a time when you're answering your questions. When you're studying the material, then that's fine, you can draw references from different sources. But once you're answering questions, you try to stick to one resource and then you complete that resource, move on to the next one. Move on to tip 3 and back to eating.
So guys, tip 3 is set your exam date. So I remember when I was about to sit my exam, wife was telling me that you know, go and set your date, and I was always telling her that I'm not ready yet. So with that being said, it's best to set your date and work towards a goal, because you will never feel like you are ready. It doesn't matter how much question you practice, how much time you study, you will never feel like you are ready. So set your date and stick to the goal, right? Don't go back and push back the date and whatever. So set your date, and luckily I did my exam just before the pandemic hit. I was telling my wife that I want to do my exam in March. She said, no, you're ready. You're going to do it in February. I said, all right, let's stick to February. And just before, just after February, they start scheduling new dates, pushing back limited amount of students to sit, and they reduced the amount of questions. That was only the good part about it. I think during the pandemic, the height of the pandemic, there was only 60 questions. That was the max, right? No, that was the limited amount. Or the least amount you could do, 60. Right? Something like that.
Or 65.
I think it was 60, 65. But somewhere there about. And I think the max was like 120 something or 150. I'm not sure. Don't quote me. But set your date and work towards it. Lest you will never feel ready.
And that is in relation to persons who are scheduling their exams on your own. So if you're not doing it through an agency, if you're in the US already, or if you're doing it on your own from Jamaica, you know you can set your own date and then you work towards that. As it relates to persons who are coming through an agency, you know that you have to do the courses and then you have to do the exams. And basically the agency teachers, I'm gonna call them, they will tell you if you're ready after you have done like a mock NCLEX exam. Based on the score that you received, they will let you know if you're ready. So they actually set your date for you. So what you can do in the meantime is just ensure that you're passing your tests, you're attending the classes that they have scheduled for you, and then when they give you that mock exam to do, you ensure that you pass it, and then you know you'll be ready for your exam. Because if you don't pass your test, if you don't go to the classes, and God forbid, if you don't pass the mock exam, they're going to tell you that, oh, you need remedial classes, and probably they'll schedule you within the next 2 months. They're not gonna put you to do the exam because they basically don't think you're ready, because that's gonna be more money for them, right, to schedule another exam and all of that. So just ensure that you prepare and you follow the schedule and the guidelines that the agency will give you. As it relates to doing it on your own, you study, set your time, and then you work towards it. That's the only way you're gonna make it, because you're gonna want to push it back because you're never gonna feel like you're ready. So yeah.
Next tip. All right, so the next tip is to resource. Get your resources together. We touched a little bit on the resources that we use, right? So my favorite resource, my two favorite resources is UWorld and Mark. So as I said,
Mark your favorite resource.
The two resources that I use, guys, are
Mark Klimek
and UWorld. So for me, I personally think UWorld mimic the exam like to perfection, right? When I was doing my exam, I felt like I was doing UWorld. I felt comfortable, I felt relaxed. It
just people something.
It feels, it just feel easy.
So for me, NCLEX I say easy.
For me, UWorld and Mark Klimek. I would sit and listen, doing anything, taking care of the baby, walking, running, and just listen to the audios, and make the information stay with me. And you have other credible resources out there, but those two are my two.
For me, I think UWorld is bomb for most persons, especially in Jamaica. as you said, you were come very close to the exams, and your rationals are simple, straight to the point. The questions are not too difficult either, and you know you have the option of renewing your subscription, or you can do it for 3 months, for 6 months, for a year if you have the money to do it. So you were for studying, Mark Klimek is very good. Mark Klimek reviews. Basically, he just gives it's recorded classes on each like condition or medication, like basically the whole NCLEX preparation. He does that. There's also the HURST review, HURST review. If you have somebody who have done it before, then they can send you the information. But I think most of the time these are all subscriptions, so you have to pay to get like the compilation audios. But HERS is very good. The thing with Mark Klimek is that he gives you analogies that you can understand and you can relate to. So he's not just gonna say, oh, this medication is to treat high blood pressure and that's it. He's gonna relate it to something else, and then you're gonna be like, oh, but I never know that. Really? Like that sort of thing. So it's easy to understand Mark. So you have you have a HERS review, you have Mark Klimek reviews, Kaplan. And you have Kaplan. Kaplan is, you have to subscribe to it. I had a Kaplan book. The information is very thorough. But the thing is, Kaplan is a little bit difficult. So if you have mastered if you have mastered the UWorld and you feel like, hey, I still have probably a month to go and I want to take it up another level, you can do the Kaplan. Like the Kaplan really make you study and make you read hard. So that's very good also. And then you know you have your regular NCLEX Mastery app that you can subscribe to, keep that on your phone. You know you're at work, you take a 5 minutes, the place is not too busy, you do a few questions, you get your rational, you do some mock tests to see how you're progressing. And which other one? Remar. You know you're good. Remar review. I had the Remar book, so she has a whole what should I call it? It's like she has the book, she has the classes, she has like online things you can subscribe to. Remar reviews, so you can check them out as well. But there are a lot of resources out there that you can use. As I said, when you're doing the questions, try not to do from too much resources at once. Studying is fine, you study from a variety because you know you're gonna need to get a broad knowledge. But when you're doing the exam questions, you try to focus on one resource at a time so that you don't get confused. And you know your good old YouTube videos, always there, like if you need visuals or you need somebody to break down something for you, YouTube video is always there for you to learn from, so you can also use those. Yeah.
Alright, so next tip is to see what tip number 5. So the next tip, guys, is
number 7
is prioritization, right? So you're gonna hear that term or see that term a lot when time you're doing your questions. But not only in your questions, you're gonna be prioritizing, right? You're gonna prioritize your lifestyle, and not only when you're caring for your patients, right? You're gonna prioritize your lifestyle. So you will have to make some adjustment, right? So as my wife just said, that the baby in one hand and the book in one hand. If it means that you're gonna cancel a party or even cancel a session to go home and study, you have to do what you have to do, right? I remember I used to go home and after 16 hours of work and keep the baby for the next 4 hours so she could get the opportunity to study. Sometimes I have to stand with him because he's crying, he wants his mommy. So you have to prioritize your lifestyle and everything. Prioritize your lifestyle, your work schedule, to ensure you pass your exam if this is something that you really need.
Alright people, so the final tip is that it basically has a lot of points. So it's gonna be called tips within the last tip. So 1, be positive. 2, believe in yourself. 3, even though you feel that you're not ready, and as you said, you may be seeing low scores on the assessments exam that you're getting, just ensure that you're reading over your information, you're writing it down if you're that type of person, you're watching your videos if you're a visual learner, you're listening to audios if you're an auditory learner, sorry. And just go in the exam with a positive attitude. Like when I went into the exam, I was a little bit nervous. I wasn't that nervous where I'm like, oh my god, I came to the US and I might fail the NCLEX and go back. Not that nervous, right? But I was a little bit nervous, and it's fine to have nerves, right? You're all human being. The heart or your excitatory system is gonna kick in, and you're gonna be in a flight mode basically. So it's fine. Just believe in yourself. Be positive. Put your best foot forward. Put your all in it, right? Tell yourself that you only have one chance to do it. I know there are a lot of persons who you may go for the first time, and for whatever reason you may fail. Go back, try to look back and see what happened, why you failed. Maybe you didn't understand like open-ended questions, or you really didn't understand select all that apply questions much. So now you have to focus on select all that apply. Maybe you're not prioritizing your questions when they ask who would you treat first, which patient would you delegate to this nurse. So you have to focus on priority. So focus on your weak areas and ensure that you master them. Right? Don't spend too much time on the areas. If you know you're very good at medication, you spend less time on medications and focus more on your pathophysiology if that's your weak area. And then the night before exam, relax, take a chill pill, watch a movie. I know for me, I'm gonna study right up until the point where I hear that I'm supposed to put the book down to start the exam. So the night I went to Florida the Friday evening, and I was to have exam the Saturday morning. And then I went checked into the hotel and all of that, get settled, and then I hit the book. Night came down, I decided that I wasn't going to go in the bed. And I did not go into that bed until when I came from exam Saturday afternoon. But I went into the chair with the book. And I was so tired because I was studying before I left Jamaica, and then I was studying on the plane, I was studying in the airport. So it's like throughout Friday night now, I have the book in the chair, and then I'm studying. I don't know what happened. I find myself waking up. I'm like, Jesus Christ, I just slept for 2 hours. Alright, then I go focus now. I start study again, and then I doze off again, and I wake up another 2 hours after, and I'm like, Jesus Christ, 2 more hours gone. But I'm done study. Like, there's really nothing more to study. But you just feel in your head say you must study until the last point. And I woke up and I did it again. And I think I called him and told him that I fell asleep and I didn't get to study anything. And I went and I washed my face and I got something to drink. And I changed my position in the chair and I fell asleep again. And then I'm like, you know what? It's like I can't study anything more, so let's just call it a night. And I just laid down in the chair for probably the next 2 hours because this was like closer to morning. And then I just went to sleep, like get some actual sleep before you go into the exam. So don't try to rush the night before exam because whatever you don't know as yet, chances are you may not grasp that information on that night. So just relax, watch a movie. If you have to listen to some calming music, listen to a sermon, read your Bible, quote some scriptures, deep breathe exercise. No alcohol because you can't wait to go to the exam the next day. So no alcohol, you just get some relaxing drinks to drink and just go into the exam and do your best. That's all you can do. Yeah, right there.